Hello, I'm Andy Deliveris, Program Director at the University of Wisconsin-Madison Department of Ophthalmology and Visual Sciences.
I'm Elaine Downey. I'm one of the PGY4 residents.
These surgery centers are extremely important to be able to get the dexterity, the movement, the temporal spatial relationships that is necessary to carry out a successful surgery. People can be much more efficient if they spend time in the wet lab.
As a resident, when you're just learning to do surgery, having an opportunity in a lower stakes environment where you can practice and develop those skills or keep working on a single skill. It's also a great opportunity, like moving into fellowship and then into faculty, to practice new techniques as new things come along.
One thing that I'm really excited about is there's a big gap post-grad and how you keep your skills up. These sorts of surgical centers can be used to not only train our alumni with new Yamane lens insertion techniques, new things that come down the pipeline. I think it's an amazing opportunity for both the community and our alumni to utilize to learn these new techniques.
So right now our equipment is a little lacking. I mean, we do have newer phaco machine. It's been good to be able to use the machine that we might actually use in the operating room. Prior to that, we were using an older phaco machine that just didn't operate the same way as the ones that we currently use. Our microscope is also older and does make it challenging to work with faculty because the second head is not as good for teaching purposes. And just a very kind of cramped, crowded space that makes it hard for us to do a lot of teaching and hard to have more than one person working in the wet lab at a time, which I think is really crucial for developing better surgical skills, because you need somebody who's there to work with you and to give you feedback, or else you can't continue to improve when you're in the lab.
We only can really cram 2 people maybe in that space, and this would allow us to go to the course level. So we could get all of our residents in there at any one time. We could invite community docs in and run a short course on lens implantation or sutured IOLs. Having state-of-the-art wet and lab dry space is extremely important. And then the other thing is maybe go down the line of simulation. We do have a simulator. It's in a different location, but overlaid with that now is this concept of artificial intelligence, or AI. And can we have the ability to take surgical videos of our residents or fellows, run them through gauging or staging programs to try to figure out what they're doing really well and where they need some improvement.
I'm Nanita Maganti. I'm one of the PGY1 residents here at the University of Wisconsin.
When you're a medical student looking for a good program, I think, is that you're really unsure, and the programs are really unsure about how good of microsurgeon you will be. We will both have a sense for how the individual will perform academically through their clinical studies as a medical student. We'll have an idea for that, but we don't know how they're going to perform as a microsurgeon. Surgical laboratories will allow people to be able to work on what they need to work on, and they're hugely important. And you really don't want that first experience to be on a live patient.
I like to get feedback as I'm learning a new set of skills, and having an additional person in the room, which could be my preceptor or the attending trying to teach me the first few steps of doing surgery, is really helpful. And having the type of space and organization and equipment to be able to do that is, I think, the first step to go with it. Additionally, if you are learning with other residents at the same time, we all know that we learn from each other's feedback as well.
Being at the university station, which will now be consolidated into one building, will be absolutely enormous. You don't have to go to an off-site to maybe practice throwing a few sutures right before you do your first PKP. You can run up to the lab and do it, and you've got faculty all over the place. To our community, to our potential donors, and especially, to our alumni and our graduating residents, because I do feel from the bottom of my heart this is the way we will give back and will be generational with our training. We couldn't do it without you. We appreciate everything that you have done for our patients while you've been here, what you've left behind, and taking what you've learned forward to many, many more patients. Thank you very much.